21st century has certainly brought with it the need for a healthier lifestyle through diet and exercise in order to stay as fit as possible. Today on the show, we're going to learn more about the Allurion gastric balloon as a form of weight loss. We're so happy to have you on the Skin Therapy Show. My name is Joy Muthengi. Welcome. Today on the show, we have a very special guest joining us, one Dr. Pancholi. It's an honor to meet you. I've heard a lot about you, but now in the flesh, I look forward to hearing more about what you've been working on here. And thank you for welcoming us here.
It's an absolute pleasure to meet you as well, and welcome to Avenue Clinic.
Thank you. So tell us, I've heard you do a lot of things here at your clinic. And I've heard a lot about you, but tell us a little bit about yourself. Who's Dr. Pancholi?
Okay, so I'm a cosmetic dermatologist that was born at Kenyatta National Hospital, studied at University of Nairobi, and then went on to Harvard to do an international fellowship in dermatology. While I was at Harvard, I authored a book, Lippincott's Primary Care Dermatology. I'm board certified by the American Academy of Laser Surgery, the American Board of Aesthetic Medicine. I'm an anti-aging medicine certified physician from Cenegenics in the USA. And I have many degrees and lots of accolades.
See, I already feel like I can trust you. And when it comes to, when we talk about matters skin, you definitely want to, be in the hands of someone that knows what they're talking about and has been tested and true. So I'm happy to have met you and look forward to knowing about all that you do. Now, amongst the range of things that you have going on here at your clinic, what we're going to focus on today is the Allurion gastric balloon. I've been hearing a lot about this. It's been all over social media, and I've been seeing people talking about this, but I don't know what it is. So maybe you can tell us, just a little bit of a definition of what that is.
Okay. So the Allurion gastric balloon, and I'm going to show this to you. This is the easiest way of explaining it.
Right.
Is also technology by a fellow Harvard physician, Dr. Ram Chutani, and this was his brainchild.
Okay.
And this capsule, this tiny capsule, is what you swallow.
Oh.
Yeah, you swallow it. Yes.
Thank you for clarifying that, because I saw the balloon and I was thinking, how do you know?
Yep.
Okay.
So you swallow this and then it goes down with the pipe, and then we fill your stomach with a saline-like substance.
Okay.
Now, once you've swallowed the balloon, there is no surgery, no anesthesia, no endoscopy, and no blood tests required. It is a simple 10-minute procedure. You swallow the balloon,
Right.
and then we fill it up in the stomach. So in the stomach, it looks like that. Here, you can feel it.
Oh, wow.
Yeah,
It
500.
feels like silicone.
Yes. And it's 550 ml. So that is, these glasses are around 275 ml each.
Yeah.
So it is the size of 2 glasses of the Minute Maid.
Wow. This is so enlightening, and thank you for letting me know about this. What is so different about the gastric balloon than other procedures that people are having to get weight loss, fat reduction, all of that? What makes this stand out?
Okay, so the first thing is that weight loss sometimes can be a difficult journey, and once you have the balloon in place, it regulates how much you can eat. It regulates your quantity of food, it regulates the satiety levels, and at the same time, it helps with delayed gastric emptying, which then modifies the entire way that your body works, and this helps to ensure that even after the balloon is out, the weight doesn't come back or comes back slowly, because there is no magic pill for weight loss. Okay?
Yeah.
If you're going to not change your eating habits, then the weight will come back. It's like it's like an alcoholic. Yeah, if you don't stop drinking the alcohol, the problem is going to be there.
Yeah.
But now, by stopping the food from coming into the stomach and regulating the quantities, and this is done together with a certified nutritionist from Allurion. This ensures that you lose the weight and that you don't regain it later.
Yeah.
And do you know what the beauty about this is?
Tell me.
So this is like a James Bond movie. After 4 months, it auto-injects and comes out from behind.
That's what I was going to ask you. That's what I was going to ask you.
You don't need to put in something to pull it out or anything like that.
It just kind of disintegrates.
Yes, and then comes out from behind.
After 4 months. I wonder what that feels like. Like, do you feel like you have a bulge in your stomach? Is it uncomfortable?
Nothing. It's like you're carrying a bottle of Coke inside your stomach. Yeah, it's not that bulgy, it's not that discomfortable. Yes, for the first 3 to 7 days, you're going to get a little bit of abdominal pain, some cramping, nausea, some vomiting, and some esophageal reflux, commonly known as heartburn.
Okay.
So you may get some of these, but then everything will settle down in a week. And then after that, you're good. And when you're on the nutritional program, within 4 months, you have lost an average of around 15% of your body weight. Wow. And if that is not enough, we have a smartwatch.
Okay.
Yeah, and the smartwatch is then connected to the Allurion scale, and I'm going to show you the Allurion scale.
Okay.
And this is a specialized scale, and what this does is apart from just measuring your weight, it gets your BMI, it gets your skeletal muscle mass, it gets your visceral fat, and it gives us a full comprehensive analysis of what is happening.
Yeah.
Now, through the smartwatch, this is connected to the Allurion app.
Oh.
And the Allurion app is available on your iPhone, and that transmits it to my phone, or to my nutritionist's phone, or to the clinic computer.
Wow.
And I mean, I have had people coming in from the USA, from Kazakhstan, from Zambia, all over the world coming for the gastric balloon to Kenya.
Yeah.
And we're able to monitor them on our computer. And if we see that somebody's not losing the correct amount of weight based on a computer-based algorithm, we get a beep saying that this person is not following the program properly. And then we're able to speak to them and see what it is that is happening.
Yeah.
It gives you 360 degrees control over the weight loss program.
Yeah. And it's like you're saying, an entire program, nutrition, everything included.
Yes,
so
nutrition,
you have to
yes.
follow the program.
Absolutely. And we encourage you to exercise. Yes, because after you lose the weight, that's not it. You can go to the gym, you can do sports, you can do activities, you can do all of this while you have the balloon. The only thing that you cannot do is skydiving and scuba diving.
Well, I wasn't going to do that anyway. So,
Yeah.
So for someone watching right now and saying, I don't know if this is right for me, who would you say is your ideal candidate for this procedure?
Okay, so obviously we have to have a look. Yeah, there has to be a consultation. I have to understand the needs of the patient. I have to see, do they qualify for the gastric balloon? And there are certain stringent requirements because this is a medical procedure.
Right.
Yes? So, one of the first things that we need to do is we need to ensure that you're the right candidate. Once we know that you're the right candidate, then I need to make sure that you have no contraindications.
Okay, and
So
that means?
there are certain conditions that preclude you from having a gastric balloon.
Yeah.
And we would go through that in a detailed history. Make sure that there is no contraindication, and then we do the procedure.
Yeah. So as you're, judging the ideal candidate, is it weight-based, or does that play a factor? Is someone maybe under the under the required weight for getting this procedure, or
so normally in most instances we look at the BMI.
Okay, gotcha. Yeah. And so when people come in and they're looking to have this procedure done, are there specific areas that this procedure targets, or is it just an overall sort of body wellness situation?
So when you do the gastric balloon, it's going to target an overall weight loss, which means that you're going to lose a little bit of weight on the tummy, the saddlebags, you lose some weight in the arms, you lose some weight around the thighs, and you lose a little bit of weight in the face, which is something that a lot of people don't like, because they're like, Daktari, now my face is falling as I'm losing weight. But as a cosmetic dermatologist, that is right up my alley. We know exactly what to do for facial lifting and tightening after weight loss. But yes, to answer your question, it is a generalized weight loss procedure.
Yeah, because a lot of people don't think about what comes after. After you've lost the weight, like you're saying, if you lose enough weight, there can be some sagging in various areas.
You can get breast sagging, arms. You call them the
bad
hello
arms,
goodbyes. Yeah, hello goodbyes, bad arms.
Oh, hello goodbye.
Yeah. So yes,
but that's something that you also deal with here at the clinic. Are there any cons to this? Because so far all I've heard is a lot of positive, outcome.
Well, yes, absolutely. And it's very important for people to know that, one, if the right candidate has not been chosen, then there can be a lot of side effects. Yeah? Esophageal reflux, yeah? Abdominal pain, gastric erosions, yeah? But this all happens when the procedure has not been vetted correctly.
Right.
You can have gastric outlet obstruction, which means that the balloon can block the end of the stomach.
Right.
But in over 60 countries, we have the Lurion balloon, and over 100,000 procedures have been performed. And there have only been 20 gastric outlet obstructions so far. And with the gastric outlet obstruction, all we do is we put in an endoscope, we plop the balloon, and we pull it out. It's a 20-minute procedure, and it comes out without any problems. But yes, there are risks with any medical procedure. Yes, even Panadol, as I like to say, causes liver failure. So it is important for you to speak to your doctor, understand the risk versus the benefit, and then make an informed decision about whether you would like to go ahead with the gastric balloon.
Yeah. You said within, after 4 months is when the balloon is discharged. But for someone who is wondering, well, when do I start seeing the weight loss?
So you start seeing the weight loss within a week.
Really?
Yeah.
Wow.
Absolutely. You start seeing the results within a week.
Yeah. And so is this something that once you've done it once, do people come back to do it again later on? Is it something that you need to repetitively do?
Okay, so this depends, because there are some people that need to lose more than the 10 to 15% weight. So in this case, what we do is the balloon stays in for 4 months, and then we give a small break, and then we reinsert the balloon again. And with that, we're seeing weight loss up to 20-25%. And one of the reasons is, why would we want to use this gastric balloon versus any other kinds of procedures? Now, the other gastric balloons that are there in the market, they require endoscopy, they have a high intolerance rate. Now, this is made using a vegetarian capsule, so it's much more easier on the stomach than anything else. Gastric bypasses surgery, you're cutting the stomach. Gastric sleeves, you're cutting the stomach. Gastric bands, they're all this is the most natural treatment, and this is proven to be as effective as any of those if you do 2 balloons in succession.
Yeah.
So that is why this is the best treatment available, and there are a lot of fakes in the market. So I would like to make sure that my viewers know that make sure that you insist on Allurion. And this is the name, Allurion, the Allurion gastric balloon. So make sure that that is what you go for. There are a wide range of different products in the market that are different. I am not that well versed with all these other companies, but this one I am trained and I've done research.
Yeah.
We get balloons from China, we get balloons from Egypt.
Oh, no.
There's all kinds of things happening.
Yeah.
And this one is from the US of A.
Okay. That's very important
Yes.
to note, because when you're doing any type of body altercation, you want to make sure that it's something that is, you know, a sure thing, so to speak. And some of the other procedures you're talking about, gastric bypass and all of that, require quite an amount of downtime.
Yes, there's a lot of downtime. This is 10 to 15 minutes. And with gastric bypasses and all these surgeries, there have been so many cases of death.
Yeah,
People just don't wake up.
right.
This one, we never put you to sleep. That's the beauty.
You're awake the whole time.
Yes.
Yeah, it seems like this is, you know, the latest sort of technology happening. There's a lot of buzz around it. So I hope people are able to take advantage of this as one of the options for weight loss. So, you know, hopefully they can come into your clinic, talk more with you and your nutritionist, and get a better understanding of whether they stand a good chance of losing some weight.
Absolutely.
We've got more to learn, definitely, about this weight loss procedure. We are talking about the Allurion gastric balloon here with Dr. Pancholi. We have to take just a short break, but we'll be right back with more of the Skin Therapy Show right after this. Stay with us. Welcome back to the Skin Therapy Show. Still here with Dr. Pancholi, and we've been talking about the Allurion gastric balloon as an option for weight loss. Lots of information and that we've gained here, but we've got a couple more questions for you if you don't mind. So sure. I know you have, you know, a nutritionist, and as someone is coming in, you do an evaluation and analysis of whether they're right for this program. But if they just, for themselves at home, wondering, you know, is this something that I should go down? Maybe I've been doing the diet, I've been doing the exercise, I've plateaued, I'm not seeing any changes. At which point, you know, should you consider this gastric balloon? So
I will always say that if you can lose weight naturally through diet and exercise,
yeah.
then that is the best way of doing it.
Yeah.
But in some cases, some people plateau and some people just reach a little bit of resistance. Like I'll have some people, they'll be 130 kilos, and through diet and exercise they've lost maybe 10, 12 kilos, they're at 118, and they're like, Daktari, I just want to get to double digits, please. Yeah? So I'm like, okay, so that would be an ideal candidate. There are people that have a busy lifestyle. They're just busy, they're working all the time, they're super stressed all the time, and sometimes they indulge in stress eating, binge eating, and they can't control themselves. I mean, business executives that are on the move constantly. Yeah, there's people that are on a flight every 3 days,
right.
going to Kisumu, going to Cape Town, going to Zambia, going to Paris all the time. And they're just eating unhealthy, and they're just accumulating this weight. So that would be another option.
Yeah. Is there, your clients who often get this type of procedure, is there a specific age that you've seen that is more, you know, frequently coming in for this?
We get people from 25 all the way up to 70.
Wow.
Yeah, because especially around 50, if you don't lose that weight, yeah, you're setting yourself up for hypertension, you're setting yourself up for cholesterol, you're setting yourself up for weak knees, joint pains, knee replacements. So there is a very high risk of comorbidity
Yeah.
when you have that excessive weight.
Yeah. There are different options when it comes to weight loss, in addition to diet and exercise, or also just in terms of procedures. We often hear about liposuction. I mean, gastric balloon is one of the latest, right? But beforehand, we've heard about gastric bypass, liposuction. What's the difference between all of these different procedures in terms of results?
Okay, so the gastric bypass is where they cut out a part of the stomach, and then they basically refix the plumbing in the gastrointestinal system,
Right.
make the stomach smaller, let some of the food bypass the stomach and things like that. Now, this is a surgical procedure that has been associated with death. Okay? And liposuction is also a procedure that has been associated with death. And there have been numerous cases in Kenya where people have died from liposuction.
Oh, I was not aware of that.
Yes, and it's really sad. I mean, you go in for a cosmetic procedure
Yeah.
and you
come
don't
back.
wake up.
Yeah.
Yeah, so liposuction has a lot of risks. So that is one thing that we need to be very careful about. There's a lot of side effects. If you look at my Instagram, it's Dr. Pancholi. You'll see I've put down some of the side effects of liposuction. There's uneven bumps, damage to the skin. There's somebody who had an arm treatment and you see these huge scars on the arms. With breast reductions, you see scars, and some of these cases that have been botched, I actually send them to Dr. Paul Nassif in LA, who is a plastic surgeon who came up with the TV show Botched.
Oh, wow.
Yeah. And if you see my Instagram, you'll see a picture of me with
That's
him.
awesome. I
And
watched
we
the
work
show.
together.
Yeah.
Yeah.
Wow. I want you to give us some final thoughts for people watching at home, concerned about their weight, concerned about, losing fat and all of these things, and considering that maybe they've heard a little bit about what the gastric balloon is about. Final thoughts from you.
The gastric balloon from Allurion is a safe and effective procedure for weight loss. We also offer M-Sculpting, CoolSculpting, and a wide array of products and services dedicated to weight loss. Speak to a medical professional before embarking on your weight loss journey. As I've said before, diet and exercise are great for weight loss, and that is what I would ask you to do first. And then if that fails, then come and see me, and we do have a lot of options for you. But Avenue Clinic is located at Yaya Center on the 4th floor. We have another branch in Parklands, and we have another branch in Gigiri. The number to contact us on is 0714 500 500. I'll repeat that, 0714 500 500. Email is info@aveneclinic.com, and Instagram it's Dr. Pancholi, DrPancholi. And yes, I look forward to helping you with your weight loss journey. Thank you.
It is indeed a journey, and Dr. Pancholi, we want to thank you so much for allowing us to come into your clinic today, for learning one of the many procedures that you offer here. Hopefully we can come back and you can talk a bit more to us about some of the other procedures that you offer to help people live their best lives. Remember, Minute Maid Delight. It's the treat that awakens your senses and fills you with vitality, with taste, with life. Because if your breaks aren't filled with the indulgent sensations of Minute Maid, now available in the delicious mango, the wonderful apple, and tropical, it's time you ask yourself, what are they filled of? Minute Maid, filled with life. So make sure you grab yourself some Minute Maid at a store near you. This has been the Skin Therapy Show. Remember, as Dr. Pancholi has talked about, it's about balance, right? It's about a holistic view of how it is that you're going to go about your weight loss journey. So diet, exercise, and then if procedures are necessary, there are a wide array available here at the clinic. Today we've learned all about the Allurion gastric balloon. If you have any questions or comments, please do reach us on our social media pages. We are on Facebook, Instagram, and Twitter at The Skin Therapy Show. Thank you so much for watching. It's always a delight to have you. Until next time, bye-bye.